Chronic Care by Alicia L. Harris, LPN. Empowering patients. Supporting providers. Increased patient outcomes and profitability. Leadership team. Our skilled team, in exclusive collaboration with ATD's MedTech solution, leverages a blend of extensive healthcare experience and care management proficiency alongside cutting-edge technology. This partnership is designed to enhance the success of your practice and improve patient outcomes. Furthermore, it facilitates your practice's ability to efficiently record billable hours via the CMS Chronic Care Management Program, ensuring both operational efficiency and financial benefit. Aorta Strategic Nursing Services. I am Alicia Lachey Harris, LPN, founder of Aorta Strategic Nursing Services, a dedicated nurse with extensive experience in case management for individuals with severe illnesses and injuries. I'm committed to advocating for my patients and guiding them through the complexities of the healthcare system. As a fervent advocate for patient education, I emphasize understanding chronic conditions and promoting wellness. My approach is tailored to meet the unique needs of each patient, ensuring they receive the best possible care and support. Account Management Team. Our strategic alliance with ATD Health Solutions Incorporated empowers us to streamline your practice's business account management and profitability analysis. This collaboration provides your practice with insights into data-driven outcomes, revenue, and profitability through regular profitability and patient outcome reporting. This enables a deeper understanding and visibility of your financial health and patient care success. Clinical Team. As your practice's chronic care management, CCM, program expands, our clinical team scales in tandem to meet your evolving needs. Our dedicated team of licensed medical assistants and supervising nurses all share a deep commitment to supporting patients with chronic conditions. This dedication ensures that your practice and its physicians can rest assured, knowing your CCM program is delivering a level of care that sets industry benchmarks for quality. Let's just take a quick look at the chronic disease burden in the United States. Chronic care overview. Additionally, people with chronic conditions account for 86% of national healthcare spending and 99% of Medicare spending is on patients with chronic conditions. Data source. Connected Care, the Chronic Care Management Resource, CMS.gov. There are more than 65% Medicare beneficiaries with 2 or more chronic conditions. Furthermore, 50% adult Americans have a chronic condition. And additionally, 75% of the deaths in 2014 were related to chronic diseases. Chronic diseases are the #1 leading cause of deaths in the United States. Benefits for patients. Enhanced 24/7 communication. Dedicated personal care manager. Tailored care coordination. Benefits for your practice. New revenue stream. Get compensated. For non-face-to-face care management. Services via Medicare. CCM 99490/99439. Complex CCM 99487/99488. Enhanced patient satisfaction. Quality care and outcomes. Reduces administration burden. Reduced incoming and outgoing office calls. Chronic care management, CCM. What is CCM? A service beyond the traditional office visit that provides personalized, ongoing support for patients with 2 or more chronic conditions expected to last more than 12 months, and that place the patient at significant risk of death, acute exacerbation/decompensation, or functional decline. Our team brings chaos into alignment. Here are some common problems. Providers lack the ability to staff and manage CCM programs, and patients are overwhelmed with coordinating and managing their chronic illnesses and medications. Common issues. I can't get to my appointment. We coordinate resources to avoid missed office visit. I have a test scheduled and I don't know how nor where to get it done. We help patients navigate the confusion to get the right care at the right time. As a provider, I just can't manage staffing, compliance documentation, and time to implement CCM. We have the software and professional team that handles this for you. CCM is all we do, so you don't have to worry about managing all the aspects that make it difficult. Full service solution. Additional revenue and increased outcomes. Integrated and locally based chronic care management solution. Increased patient care provides ongoing, tailored care to improve patient health and satisfaction outside of the clinical setting. New revenue. Access to Medicare payments for managing chronic patients, adding income without extra workload. Cost savings. Reduces hospital visits and costs by effectively managing chronic conditions. Ease of compliance. Handles complex regulations and reporting, ensuring the program meets all legal requirements. Staffing solution. Can easily expand to support more patients as your practice grows, without adding stress to you and your HR team. Software that produces results. Our custom-developed Salesforce-driven software sets the standard and has been custom-built focusing on 4 key aspects of CCM. 1. Data-driven. Care supervisor and manager dashboards with data-enabled CCM support tools. 2. Task-oriented. Efficient task-enabled analytics ensuring compliant time documentation. 3. Compliance-focused. Monthly individual patient summary reports with detailed encounter logs. 4. Simplified billing. Master patient billing reports with CPT-eligible identification for fast billing. Increase profitability and patient outcomes. Potential profit with only 200 enrolled patients. $75,000 plus. First-year profit with only 200 actively managed patients enrolled. $100,000 plus. Second-year profit maintaining only 200 CCM patients. 95% plus. Billing and compliance rate. Estimated total 2-year profit with 500 patients. $318,000 plus. Enrollment percent is expected to be 20% to 30% of your Medicare patient population. 2,000 Medicare patients would equal an estimated 500 CCM enrolled patients. Assumptions. Enrolled patients bill $99,490 100% of the time, $99,439 100% of the time, and a second $99,439 30% of the time. Billing is an optional add-on and not included in this chart or the prior slide depicting first-year revenues. Note: additional office visits and telehealth E/M encounters with patients are common with CCM enrolled patients. Amounts based on national CMS reimbursement. ATD Healthcare Solutions, your CCM journey starts here. Options. 1. CCM only. Cost, $35 per patient. Services. Chronic care management services. 20-minute subsequent sessions, HCPCS code 99439. Complex CCM for 90 minutes, HCPCS code 99487 plus 99489 at $140 per patient. Profit, $50 plus per patient, 20% plus eligible. Average reimbursement and profit. Codes 99490 plus 99,439, $60.42, $45.60. Overall profit, $35 plus per patient. 2. CCM plus RPM, top choice. Cost, $55 per patient. Services. Per active patient, codes 99454 plus 99490. $15 per RPM savings. Benefits. Increases compliance and participation rates. Average reimbursement and profit. Codes 99490 plus 99,439 plus 99,454, $60.42. $45.60, $51. Overall profit, $35 plus per patient. 3. RPM only. Cost, $35 per patient. Services. Remote therapeutic monitoring. 20-minute subsequent sessions, HCPCS codes 99457 plus 99458. Cellular-enabled devices. Includes blood pressure, pulse oximeter, glucometer, and weight scale, $120 each. Average reimbursement and profit. Codes 99454 plus 99,457, $51, $45.60. Overall profit, $25 plus per patient. All options provide structured support and monitoring for chronic care management and remote therapeutic monitoring. Next steps. How can you get started? Simple MSA and BA. We are essentially an extension of your team, working under your supervision and direction, which eliminates your need to hire, develop, and manage your own CCM employees. Implementation. 1. Assign a point person from your clinic to facilitate onboarding, typically 1 to 2 weeks. 2. Identify eligible patients in EHR, CCM, and RPM. We go to work. 1. Collaborate and develop care plans to be reviewed, revised, and signed by the overseeing provider, CCM, through a simple desktop or downloadable app. 2. Contact patients to obtain and document consent. 3. Educate patients on the program. Thank you for considering partnering with us to manage your CCM program. We look forward to the possibility of working with you, Alicia Harris, LPN and ATD Healthcare Solutions. Let's get started today.